Dr. Avinash Desousa is a psychiatrist and also the founder trustee of Desousa Foundation. Desousa Foundation works in the area of mental health awareness across all sectors in Mumbai. Dr. Desousa holds an impressive set of academic credentials in the field. He is a qualified degree in psychiatry, an MPhil in applied psychology, MBA in human resource development, and Doctorate in clinical psychology from University of Hertfordshire. He has published over 440 national and international, he has published in over 440 national and international journals and is the author of 8 books in the field of mental health. Today, the topic of Dr. Avinash Desousa's presentation is the neurobiology of child sexual abuse, what happens inside the brain. I welcome Dr. Avinash Desousa.
What child sexual abuse does to the brain is something which we've now received a lot of insights considering the advances in neurobiology and considering the advances that brain imaging offers us. Well, sexual abuse is a psychological trauma to start with, but most importantly, it is a psychological trauma with biological ramifications. And somebody who is been through the trauma of this form of abuse has a brain that never remains the same. Whether you have been through this once or whether you have been through this repeatedly. I am not going to go into too many medical details because we may not have a medically equipped audience, so I'm going to give you more of an overview because there are multiple sub-themes under what child sexual abuse does to the brain. If there are any things that you would want to know more in detail, my email will be there at the end of the presentation. You can email me, I'll send you papers. Everything I mentioned, there are around 20-30 papers for each fact that I mentioned, so I could send you papers if you want to know more details. Well, the reason, I'm sorry, the orientation of the slides have changed after I've sent it, but never mind. Why are we discussing neurobiology? Well, the reason is that child sexual abuse is a traumatic event which is very different from other trauma. What I mean by this is, if it is, say, a road accident, say, war, say, somebody even who undergoes a rape, I always say child sexual abuse is very different because one, it is a repeated trauma. You will have children who come to you with one episode of abuse, yes, it happens, but very often most of the cases that come to us are repeated episodes. So they undergo the trauma for some time before they communicate to someone or it's found out and they come for help. So there's repeated barraging at a brain level that happens, which doesn't happen, say, in an accident or doesn't happen in a head injury, doesn't happen in a rape, which is, it is equally maybe traumatic, but it's a one-time trauma. The second thing is that child sexual abuse occurs at a very critical stage in brain development. Normally it would occur between the ages of, say, 3, 2.5 to the age of 10, 11. And very often this is a period where the brain of an individual is developing and there are new neurons being formed. Neurons are the basic cells in the brain. There are new connections being formed, and at that stage to have a trauma has far more greater impact than to have a trauma at the age of 35 or 40. Another thing is that child sexual abuse affects the brain both structurally and functionally. What I mean by this is, if I take somebody who's been through the trauma of abuse and I do an MRI, I might see, okay, the MRI looks normal, his brain is perfectly fine. No, but it's the connections within the brain that have undergone changes. Sometimes it can happen that even on an MRI, certain brain structures show a bit of a shrinkage due to the repeated nature of trauma. So there's structural and functional changes that occur. Child sexual abuse leads to a variety of psychological disorders, and the reason is its effects on the brain. There are some who come out strong and are very resilient. There are some who get depressed, some who develop post-traumatic stress disorder, some who go into a psychosis or a schizophrenia like picture, some who develop lifelong personality changes. So the plethora of disorders is due to the changes that occur in the brain. Child sexual abuse also has hormonal ramifications, right from the attainment of puberty to the effect that different hormones have on the brain. The socializing hormones may reduce, the aggressive hormones may increase, the depressogenic hormones may increase, and most importantly, chemicals in the brain go up and down. Also, there are a variety of genetic and environmental factors that determine this. For example, let's take two children who've been through the trauma of abuse, one with a complete family history which is clear, and one which already has a family history of a psychiatric problem. Say the mother has depression or the father has anxiety. The effects are going to be far greater in this child because the genetic preponderance to a mental illness or the genetic preponderance to a psychological disorder is already there, and now this trauma affects that brain. Sometimes it also happens that the environment, whether I live in an environment of poverty, I live in an environment of, say, the upper class, I live in an environment where everything is provided for, whether the child is in a single parent family versus whether the child is in a family that is united, whether the child is in a family which is dysfunctional. So there are multiple genetic and environmental factors that determine how the brain responds to child sexual abuse. If you look at studies done on the structural and functional brain differences, it has been found that children who have been through abuse and abuse-related post-traumatic stress disorder have smaller hippocampal volumes. Hippocampus is the main area in our brain that stores memory. And there are sexual differences between men and women. They found that yes, the memory center in men is a little smaller than that in women. Women register memories more, they remember better, there's no doubt about that. But the fact is that at the same time, an emotional trauma like abuse affects a girl child far more than it, memory-wise, than it would affect a boy child. And the reason is structural and functional differences in this hippocampus. Also, over the years, they found that the brain in children who have been through abuse is slightly smaller as they grow. Not that this may have far-reaching implications, but it does have. This change also affects treatment because resilience and recovery depends on the brain being intact. If the brain is affected, recovery takes longer. If the brain is affected, resilient recovery takes longer. And it also plays a very important role in empathy and trust development in a therapeutic setting. Very often therapists who I meet who deal with patients who have been through abuse say that we have not been able to break a glass barrier that is between us and the patient. The patient speaks, I listen, I talk, we discuss, but somehow that bond that I may develop, say, with another patient, I find sometimes I'm not able to develop with this patient. The reason is empathy and trust development is affected at a structural brain level and at a functional brain level. And it also affects various structures that even determine your response to psychotherapy. Though psychotherapy is a psychological form of treatment, it has now been proved that psychotherapy induces biological changes. Your brain undergoes changes when you undergo therapy. So those areas that undergo change in therapy are affected due to child sexual abuse, and probably your response to prolonged psychotherapy is also affected. One of the first structures that we're going to look at is the amygdala. The amygdala is a very important structure from the point of view of fear and emotional memory. And this is smaller in children with child sexual abuse who've been through it. And as they grow, it remains smaller. That's why very often many of these patients who come to me say, I feel emotionally numb. I do not respond to emotions when people come to me with emotions. And there are a lot of memories which I have just blotted out. The reason is this shrinkage of the amygdala. This is just, you need not get into too many details, but this is just to show you how genetic factors and neural factors leads to reduced empathy, impaired decision making, and increased threat sensitivity, which is very common in these victims. The second structure we already spoke about is the hippocampus. The hippocampus is the center for all memory, emotional, academic, personal, autobiographical. Autobiographical is you, your memory which you have with your parents, your family, all those memories, and most of the patients who have been through abuse and trauma who come to us generally tend to forget certain autobiographical events. They also tend to blot out emotional memories. The reason is this hippocampus shrinks. It is amazing for you to understand that on one hand, a trauma like child sexual abuse shrinks the hippocampus. Very high fever at a young age also shrinks the hippocampus. So that only shows how biologically damaging the trauma of abuse is. Also, what happens as a result of this is they are not able to sometimes perform academically in the long run because memory defects ensue, and very often their grades go down. We feel probably he's depressed and that's why the grades are going down, but it could probably be a biological reason why the grades are going down. The hippocampus is involved in memory processing and retrieval of fear-related memories, and because it shrinks, many of these patients do not like to come out with these memories in therapy. A very important structure in the brain is the prefrontal cortex. It is the seat of judgment. Let's say you have a family member today who's admitted into a hospital with a heart attack. The doctors come and discuss his case with you. Should we operate? Should we not operate? You need to have finances to operate him. You need to plan your finances. Your prefrontal cortex does that. That is an area which develops by the age of 18. In some people, it may not develop till 30. Sometimes if you have to mature early, and let's say you've had some early death of a parent and you have to start working, it may mature by 15. But child sexual abuse occurs before this area matures. And the abuse occurring delays maturation of this area. Therefore, executive functioning, rational decision making, impaired judgment, what to do when, confusion when they are in a very stressful situation is a very common problem that we see in our victims. And these are the three main areas, the amygdala, the prefrontal cortex and the hippocampus, which are affected in trauma. The thalamus is our sensory area. We won't go so much into that. Another reason why child sexual abuse occurring in the developmental period is very vital is because in the brain we have something called synaptic pruning. It's like the trimming you undergo when you go for a haircut. Similarly, in our brain, as you can see in the slide, at birth we have certain number of synapses. Synapses are when two cells in our brain join, there is a small gap between them, that is called the synapse, and that is where information from one cell to the other is transmitted. So it plays a vital role in information transmission in the brain. These synapses usually are less till the age of 2. Once the child is post 2, between the age of 2 and 9, as you can see in a 6-year-old, they are very dense. And later on as you grow, pruning occurs. A very classical example of pruning in your brain is, if I ask you who your first standard class teacher was, you'll remember. If I ask you what was the first lesson in the Hindi textbook of your first standard, you don't remember. Because your brain has pruned that off, that's not needed. This pruning is damaged in children with child sexual abuse. So therefore they retain certain unwanted memories. They retain certain memories which may even be false. They retain certain memories which are highly traumatic, and they are not able to leave and move on. And at the same time, overall synapse and neuronal development throughout life is a little slower. And that is one key area at a functional level that affects. This is another graph to just show you that human brain development is maximal between the ages of 2 and 10. And that's a period when the abuse and the trauma occurs. Neuroimaging studies, we have, of course, you all know the MRI. This is just to show you the advances made in the neurobiology of child sexual abuse. We have the MRI, which is a structural brain imaging tool. We have now advanced to what is known as an fMRI. An fMRI is your normal MRI. Many of you have seen a normal MRI. And those red areas are areas of the brain which light up while doing certain activities. So while I'm talking to you, I can have an MRI machine above me, and the scan will show what areas of my brain are lighting up when I'm talking to you, whether I'm actually thinking when I'm talking to you or not, whether I'm using my memory center when I'm talking to you or not. And they have found impairments, as you can see in the prefrontal areas. We've also moved now in neurobiology to the advances where we have something known as tractography. Tractography, as you can see, is an MRI where connections between brain areas are seen. So we even come to know whether your prefrontal cortex connects well to other areas or not. And these connections are highly disrupted in victims of child sexual abuse. Still further, we have a PET scan, which is available at Jaslok and Tata and certain centers, where when we do a PET scan, we find metabolism in certain areas of the brain are low, particularly the emotional areas, particularly the memory areas, particularly the prefrontal cortex. So that shows us that a functional brain damage is very common in child sexual abuse. People who experience trauma, therefore, are 4 times more likely to suffer from alcohol dependence, 4 times more likely to have a sexually transmitted disease, 4 times more likely to use injectable drugs, 3 times more likely to be on antidepressants because they get depressed, 3 times more likely to exhibit absenteeism from work, 15 times more likely to attempt suicide, 2.4 times more likely to probably smoke tobacco, and have job problems and experience depression. It is these changes in the brain that lead to all these things that come up in the long run. There are also genetic and epigenetic factors. What is epigenetics? Genetics we all know. Epigenetics is when you have the genes but they need to be triggered. I always say having a gene is like having a bullet in the gun. Someone needs to press the trigger. So let's say both my parents had diabetes. I have the genes for diabetes. But I won't get diabetes if I maintain a diet and a good lifestyle and no stress. But the moment there is some stress and that gun is pressed, there are chances that yes, I will get diabetic. So if let's say in your family your father has a thyroid problem, you may not develop a thyroid problem. But when there is stress in your life, chances that you will develop a thyroid problem are far more. Same way, if a person who has a history of depression, or a person who has a history of mental illness, or a person who has a history of any medical problems in the family goes through a trauma like child sexual abuse, the gun fires, and the chances that he'll develop those problems in later life is far more. There are pertinent epigenetic factors that includes family history of mental illness, that includes dysfunctional families, that includes divorce, that includes maternal deprivation, parents working abroad. A lot of factors have been seen to be there. And these factors also affect the connectivity in the brain. It's a well-known thing. This is just to show you the hormones and trauma. One is adrenaline and noradrenaline, and the other is cortisol. Let's say you're going home today and you come to know that a close friend is hospitalized and is fighting for his life. Immediately cortisol releases in your body and you get anxious, you begin to feel all those emotions. Cortisol release is far more in victims of child sexual abuse. So any stress, more cortisol is released, and over time chances of developing medical illnesses increase. Opiates are your body's natural morphine. They counteract physical pain. And victims of child sexual abuse have more opiates in their blood. And many of them therefore sometimes might engage in self-injurious behavior as a way to cope with their trauma. Oxytocin is the socializing hormone. They say when you fall in love for the first time and you hold your partner's hand for the first time, oxytocin releases 10,000 times, only the first time. After that, I don't know whether it releases or not. But the thing is, the first love, that's your first crush, your first love, massive burst of oxytocin. This oxytocin is little low in victims of child sexual abuse. Therefore, very often if someone says, I know what trauma you've been through, but I love you and I want to marry you, they'll immediately say, no, I'm not interested. And they don't have the same feelings that someone else might have in such relationships. So many of their partners who married them feel they're a little emotionally cold. The reason is this oxytocin being low. And if you look at TBI is traumatic brain injury, that is if in a road accident you hurt your brain, and post-traumatic stress disorder we all know, there are symptoms like fatigue, irritability, depression, insomnia, cognitive deficits which overlap. So any psychological trauma is very often as good as partially having a brain injury. Environmental factors that affect the victim of child sexual abuse: poverty and malnutrition. A child who has been abused and is anemic is more likely to have brain changes. So a child who's malnourished is more likely to have brain changes. A child who's from the lower socioeconomic strata, poverty is known to affect synaptic and neuronal development because of various factors. That's a separate topic altogether. That is known to be one factor. Maternal and parental deprivation, parents not being around. Very often we come across cases, parents are working abroad, the grandparents are looking after the children, and abuse happens. So the parental figures not being around is a major factor. Parent-child relationship not being good is a very important factor versus being secure. Secure is a good protective factor, not being good is a negative factor. And if the child already has some other problems, in the sense if he has learning disability, or if he has some academic issues, or if he has some medical disorders, or if he has epilepsy, and abuse happens on top of that, well, that's a further damage to the brain. Similarly, a child with, say, intellectual impairment or autism undergoing abuse, it's a further damage to the brain. Even puberty in children who have been through abuse may be delayed or it may be accelerated. It can occur earlier because of the effect of hormones. And if the child is already depressed due to certain other factors, is a case of childhood depression and undergoes abuse, well, there's a far more damage that happens to the brain. Critical issues that happen is these children in the long run show defects in decision making and executive function. They also show impulsivity and react to stress in the wrong way. They may show attachment, either overt attachment, too much attachment, or detachment in relationships. Also, transference and counter-transference issues comes up in therapy. It's far more often in these patients. And these often are roadblocks in our therapy. Aggression and non-suicidal self-injury is also very common due to this trauma. And there is an ambivalence because the prefrontal cortex damage leads to an ambivalence. They move from therapist to therapist, doctor to doctor. They're unable to decide what should they do, and compliance to treatment may very often be affected. The key thing is that there are many who don't wish to sleep for the fear of nightmares. Sadly, there are many who don't wish to wake up for the same fear. Thank you.